Okay, well, hello everybody. Hope everybody's having a great day. It's Thursday, basically high noon on the 26th. I've been really impressed and pleased with the progress we're making on the APA issues with our discussion questions and to a lesser extent our quizzes. Just think when you take the quiz that it's going to be roughly in the DQ format, solid paragraphs. Try to throw a citation or two off of there off the top of your head since you probably just read the textbook. It doesn't have to be verbatim, but like the main idea or whatever that you've covered in that reading material for the week, put that in your quiz essay. But the DQs are making great progress. I'm totally pleased with that. The rehab site visit that's due in roughly a month. I know that I've been getting some emails from students saying, is this place okay or is that place okay? I would highly recommend that you complete your on-site, in-person visit about 2 weeks before the paper is due. Why? Because what happens if you wait till the last week and the person cancels and then they go on vacation or who knows what happens? I would try to, first of all, select your site now, set up the appointment, go see them sooner rather than later, and then the ball is in your court and you just have to write up the paper. It shouldn't be that big of a deal. It's 6 to 8 pages, APA format, which is really 3 to 4 pages. From your interview and asking the person questions and a review from their web page and literature and their mission and goals and blah, 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 blah. It'll probably be a problem to be that short. And if you'd like to go a little bit over, I'm cool with that. Just don't turn in like a 20-page site visit paper. I think, let me just pull up our grade book real quick before we jump into the lecture. Because I think we're all caught up except for this week's work. Yep, so for my to-do list, most people have taken quiz 4. I know it's not due till the end of the day. It looks like 2/3 of the folks have. Looks like everybody's got DQ4 in. Now for the discussions, remember, there's 2 parts to this. The most important and time-consuming part is your original discussion question posting in APA format with the cover page and the running head and 3 to 4 solid paragraphs with 1 citation per paragraph, and try and really think about all the stuff that you said in your DQ and then have a conclusion paragraph. That's really important. That's just how any writing should be done. If we're in English 101 or Finance 205 or, CNSL 6376, you have your narrative and then you'll have a conclusion. Okay, based upon all said evidence and information and statements and facts and so on, here's my opinion, conclusions, impressions, and so on. So it looks like we're all on track. So keep in mind that next big assignment is due at the end of the month. So we got a few weeks, but hint, get the in-person, face-to-face. I want you to walk around and see this place because many times the site visit could turn into an internship, or in some cases actually turn into jobs, or both. Because many times if you do a good job at your internship, after they've invested a year in you, they want to keep you. So just some food for thought. So let me open up the PowerPoint slides for this week. So the vocational evaluation process. Now, what I would really highly recommend is that you approach rehabilitation counseling almost like a physician would approach a patient. Let's get some evidence, testing data, if we're doing the medical model, CT scans, blood work, x-rays, whatever. Then they'll have their clinical interview. We have our structured clinical interview. So for the doctors, they're doing CT scans, MRIs, blood work. For us, we'll be doing testing like personality, interests, intelligence, maybe some others, but those 3 would be a bedrock of what I would utilize in my vocational evaluation that's going to drive everything that we offer them. The rehabilitation plan or IPE that we put together, the services that we're going to offer them, the duration of services, what kind of jobs we're going to be looking for down the line. It's all interconnected. So the evaluation process, to me, this is really my area of expertise. I probably have done about 5,000 vocational evaluations or assessments. The difference between an evaluation, more information, longer report, vocational assessment, a little bit briefer report, a little bit less information, but the theoretical and logical structure should be basically the same. So what do we want to do in the evaluation process? First, we want to understand who they are. What makes them tick? What are their strengths and weaknesses? What are their values, interests? I mean, sometimes things that would not be important for client X might be super important for client Y, like religion or socioeconomic status or sexual orientation or fill in the blank. It doesn't really matter. Everybody's different. I mean, we can't really look around our classroom because we're doing this online, but think of classes that you've been involved in or you're just walking down the street. There's many different types of people, races, genders, SES, background, religions, the whole 9 yards. So those are pieces of who this person is that we need to understand. We need to then help them and educate them, kind of like psychoeducational education, where we need to explain to them the potential job opportunities that we feel would be appropriate to them given all the stuff we just talked about: age, education, physical or mental cognitive disabilities, what income they're going to need to support their family. They got 15 kids and they're all in college. Well, this person can't work minimum wage. If I get them that kind of job, that's not going to last and it's a waste of everybody's time. So the labor market data is quite important. That's something that really will set us aside from, say, school counselors or clinical mental health. They don't really have a heartbeat on the labor market, what jobs pay, what it takes to get jobs, the training, the growth of the labor market, and so on. Now, next thing, again, is kind of like an area of our specialty, is what kind of supports? How do we mitigate the barriers? Can we use assistive technology? Can we utilize a job analysis to maybe modify certain parts of the job? Can we restructure the job? Can we change the hours? Can we get them a helper? Who knows? The next thing is, what resources, many times, especially if you're in the public sector, like the community resources that are out there. So the Chimes, the Goodwills, maybe the public libraries, maybe some churches for if we need to do English as a second language courses. It's case by case, and geography is a variable as well, because what's available in New York City might not be available in Mississippi, and so on. And then, other services, how much job placement, career coaching, counseling, what are we going to have to provide so that we feel essentially what we're going to be doing is creating a hypothesis. So we're going to do this evaluation phase. We're going to collect evidence, come up with a diagnosis, a treatment plan, i.e. rehabilitation plan, and then design the services to obtain whatever goal we set collaboratively with them. So what are some parts of this? Well, the intake interview is number one. If you're in the public sector, this is also like qualifying them, or are they eligible for services? That's one of the things that would be done right up front in the public sector. Again, a difference in the private sector, what qualifies you? Money. Somebody's going to pay for your services. The next one, general medical evaluation. Sorry, I was waiting for an attorney to call me back. They can be quite difficult to get in touch with sometimes, unless they need something. So going back to the general medical evaluation. So we talked a lot about this in the prior lecture. Basically, what's going on with this person? Are they going to get better? Are they going to get worse? What kind of treatments, surgeries, therapies, can we offer this person? Are they going to need? What kind of medications will they need? What are their limitations? I mean, that's, again, think of the funnel. No disability, no limitations, and then they get more severe, and that cuts out certain occupations or jobs that they can do. Then we might send them to a medical specialist evaluation, it could be psychiatry, it could be physiatry. Physiatry is a doctor that's trained specifically in rehabilitation. Again, it depends on the primary and secondary diagnosis. If it's traumatic brain injury, again, we need to send it to someone that knows how to deal with that issue. And then the vocational evaluation just flow from all that stuff. Once we get the pieces, then we can do our job in the vocational evaluation. So the intake interview, I highly recommend it's structured. I believe in the files section you'll have and I might have put it up in announcements, I'm not sure. But if you guys don't have it, let me know, shoot me an email. I will send you the structured clinical evaluation that I've done thousands of times. Why do I do the same Q&A sheet? because I'm human. I could forget to ask a question. Furthermore, say a year down the line, oh, you never asked me that question. Well, wait a minute. On page 4, I ask you, do you have any arrest history? And you said, quote, no, end of quote, and so on. Many times when I do the interview, I probably will know the answers to some of the questions I'm asking. And that's, when you do a clinical interview with someone, again, I think we've talked in the past about perception as reality to some people. But, hypothetically, say I know they've been in 5 different car accidents, and I asked them the question on the bottom of page 2 of my form, have you been in any other injuries? No. Never any sporting injuries, car accidents, workers' comp, you never had anything? No. But then in the medical records, I see they've had 3 surgeries. That tells me something about my client. So there's a lot of goals. First of all, rapport. If we can't get a good counseling relationship going with this person, it's going to be almost impossible, very difficult to do a good job. And they're going to get less out of the counseling relationship as well. So it's kind of like a twofold relationship there. So we need them to trust us and basically feel that we are in their corner and we want to help them and that we're competent. These are really important things. Maybe it can happen over a couple sessions, maybe the first session, and so on. So then probably what I would do is after I go through some basic things, name, address, doctors, what happened to you, injuries, other medical condition, hypertension, diabetes, cancer. Then I go through their vocational background, schooling, and then ask questions, okay, what were your grades like? What classes did you like? What classes did you hate? Sometimes that helps me pick up on learning disabilities, and then my testing data can confirm that. Then I get into, okay, what other schooling have you done after high school, theoretically? Then I go through in detail their work history. Where did you work? What was your job title? When did you work there from when to when? When was your starting salary? What was your ending salary? What was an average day like? Why did you leave? And so on. So if the person has a pattern of, well, I didn't like my boss told me and I told him to F off or whatever, again, that's one data point that helps me in my evaluation. And the whole thing here is all this information is to formulate a rehabilitation plan. And let me just finish about like my intake interviews. So after I go through the vocational history, then I start asking them questions about, how are your computer skills? What are your activities of daily living? What's an average day like? Then on the last page, I'll get into, do you have a driver's license? Any points? Any DWIs? Have you been in the military? Any arrest record? And so on. Then I usually will try to create what I would call a genogram, like a family tree of mom, dad, aunts, uncles, brothers, sisters, and their educational background and their vocational attainment, and looking for patterns. And we don't have time to get into why, but that's good information to have. The general medical examination, we talked about this. Essentially, we need to know what's their diagnosis, primary and secondary, and maybe they got more than that. What are their physical and or cognitive limitations? What treatments are going to be recommended? What medications are they taking? What are the potential side effects of said medications? Because if this person's taking Xanax and Percocet and Oxycontin and all kinds of stuff, I'm not going to turn them into a truck driver. And furthermore, that might affect my retraining options and so on. But we'll just keep it simple there. We want to get an idea of what's their functioning like, not just vocationally, but also in their social networks. I usually have a psychosocial paragraph or 2 assessing their psychosocial issues, or maybe they don't have any. Are they going to get better? Are they going to get worse? What's the prognosis? What's the treatment? What are the implications of all these things that I need to think about when I'm doing my rehab plan? Now, the specialist evaluations, case by case. Some people might need a psychiatric evaluation. Say I'm interviewing them and they just start saying bizarre things and their behavior is bizarre. Then I might be sending them out for an evaluation to see what else is going on with this person. Again, I would send them like a cover page. If I'm referring the person to a doctor or a psychologist or whoever, I would have my cover sheet with a synopsis of who this person is, what happened, and what do I need from the provider's report. The psychological evaluations, they can diagnose all kinds of things. intelligence level. Now, one thing that is probably different, the work that you guys are all doing, is when I come into a case now, my forensic work, I'll always have two sides of the story. So we got the client or the consumer or the evaluee, and Dr. X will say it's black, and Dr. Y will say it's white, and Dr. X's IQ is 70, and Dr. Y's IQ is 80. That's why I do my own testing. It's called triangulation. So 70, 80, and when I do my IQ test at 75, okay, boom. I know I have a confidence interval of where this person's true intelligence really lies. Also pick up other things like maybe learning disabilities, diagnosis, depression, anxiety, the list goes on. And then again, once these things are identified, how do we help the person solve these problems or issues? They usually go through a formal battery of testing. It's going to be different depending on the provider, if it's a psychological evaluation versus a medical evaluation, or a neuropsychological, which is a mixture of the both, neurology, medicine, and psychology, neuropsychological. This really will lead to, are there certain jobs that this person is more suited to, and are there jobs that we should stay away from, and so on. Now, the vocational evaluation, this is where I come in, or you come in, and we put all these pieces together and start coming up with, what can we do to help this person? Sometimes the answer is nothing. The person's too far, there's nothing we can do. The head injury is so bad they cannot not learn anything. And then in my report, I would just say, unfortunately, given the severity of the traumatic brain injury, this person has no rehabilitation potential. Now, that's rare because we all want to try to help people, but sometimes the facts are the facts. So really what we're getting at is, what's the person's ability to work? The battery just came on, so let me maybe be a little briefer. What kind of jobs can they do? Part-time, full-time? What kind of training they need to get these jobs? What kind of jobs will be appropriate if we invest in the training program? Not all clients that are referred for vocational rehabilitation even get an evaluation because it costs money and time. I would not work with a person unless I did my own evaluation. That's just how I like to do business. But we talked about a lot of things that we would get in the eval: intelligence, aptitudes, personality, come up with some opportunities for them, some recommendations for services, and so on. Now, there's all different types of testing: paper and pencil testing, computer-based testing. Think about it. Based on your client, say I got someone that's 65 years old and they really don't use computers. Well, they would probably feel much better in the paper and pencil testing than if I stick them in front of the computer. Furthermore, if they have some anxiety before they're even taking the test, it could affect the validity or the accuracy of the results. There's all different types of intelligence tests that you see in there. The Wechsler is the gold standard. Slosson's another one. Stanford Binet. Or if we're working with children, it'd be like the WISC, and so on. Aptitude tests, there's all different ones out there. You can do the general aptitude test battery, Woodcock-Johnson. I've done the wide range achievement test thousands of times. It's cool because you can go from 5 to 94 of age. Actually, I just published an article that maybe I should put up on Blackboard of what psychometric instruments, i.e. tests, do rehabilitation counselors utilize for vocational evaluation. That was the first study ever done. No one's ever actually looked into it, surprisingly. Personality test. Minnesota Multiphasic Personality Inventory, MMPI, 567 questions, awesome instrument. CPI basically borrows a lot of these same questions. It's 434 items. 16PF is another one that's a little bit quicker. For me, I use the Strong Interest Inventory and Self-Directed Search. I used it thousands of times. It's based on Holland's theory. I like using those. There's several other ones that are in the chapter that you can take a look at. Work samples. These allow the client to be able to try utilizing tools and materials to see if they can actually do this kind of work. There's other computerized things, Valpar Tower, JEVS. I personally don't really use them as much. I like to do it the old-fashioned way. Situational assessment is really when the person is in a simulated work environment. So, okay, they want to go back to GM as a car worker. Let's try to have a pseudo assembly line in the physical therapy department or something like that. And then the vocational evaluation report. So all this stuff gets put into a report. Now, vocational assessment could be 5, 7, 8, maybe 10 pages. A real vocational evaluation, assessment shorter, evaluations longer. The ones that I usually write are about 25 pages, give or take. With all the appendices and fluff, it could probably be around 40 or 50 pages. I've seen vocational evaluations that are 100 pages. Now that's a little bit too much, but different strokes for different folks. So if you guys have any questions about this, the battery here is running down, so I don't want it to die on me. But send me an email if you're interested in seeing the research that was just published on what psychometric instruments rehab counselors use for assessment. If you don't see in the file section my structured clinical interview, please let me know. I'll send that out with an announcement. And just keep up the good work. I'm pleased with all the progress we're making, our discussion questions. And if you need anything, please let me know. That's why I'm here to help. I want to help as best I can. So that gives us plenty to work on for this week. I hope everybody has a great day, and take care.